Welcome, everyone, to the Comprehensive Breast Cancer Primary Prevention Plan for California's first study group. This project is just getting up and rolling. We're going to have a good conversation today to give you an overview of what this project is, and we're very interested in hearing your feedback. So we look forward to a good conversation with that. My name is Heather Sarantis. I'm the project coordinator on this, and we're going to hear from a number of people who are involved on this project as well. So we'll go on to the agenda. So today we're going to talk about first, who is Breast Cancer Prevention Partners, give you an introduction to the group that's running this program. Then we'll give you an overview of the Comprehensive Breast Cancer Prevention Plan for California, so you can get a sense of the project that we're introducing. Then we'll go into some of the background and foundation of this project, including an overview of the complexity of breast cancer risk, looking at the methods that we're using for developing this prevention plan, and then talk to you about how we're going about developing our recommendations for an action plan, a conversation about how you can be involved, and then at the end we'll have a discussion. So with that, I'd like to turn it over to Janet Noodleman, who's going to introduce you to Breast Cancer Prevention Partners.
Hi, everyone, and thank you for joining us today. We could not be more excited about this project and the opportunity to work with all of you to make it happen. Until about 4 months ago, many of you knew us by the name we carried for the past 25 years, the Breast Cancer Fund. We changed our name in March to better reflect the primary focus of our work, breast cancer prevention, and to elevate the central role of the partners and partnerships that make this work possible. By working with a wide variety of NGOs, sustainable businesses, and scientists, including many of the people on this call today, we have made enormous gains over the course of the past 25 years. We wrote and released 30 major studies, including our seminal report, State of the Evidence, the Connection Between Breast Cancer and the Environment. We've convinced major industry titans like Johnson & Johnson, Unilever, and Campbell Soup Company to practice a higher level of ingredient disclosure and to sell safer products through our campaign for safe cosmetics and our Cans Not Cancer campaign. We led a successful national effort to ban phthalates from kids' toys. We brought 8 bills to the California governor's desk in the past 10 years to force disclosure of Prop 65 chemicals in cosmetics, to create the nation's first biomonitoring program to measure the pollution in people, and to better regulate the safety of radiation-emitting medical and dental devices, among others. And we're working on what will hopefully be our 9th state legislative victory right now to force companies that sell cleaning products in California to fully disclose the ingredients in their products. Plus, we climb mountains. A fitting metaphor for this work. Since 1995, our climbers have brought over 500 women and men together to climb the highest peaks in the nation to support our work and our mission. But the more we do, and our partners do, the more we all see how much more there is to be done to truly prevent breast cancer, which is why this project is so important. Next slide, please. Next slide, please. The overarching goal of the Comprehensive Breast Cancer Prevention Plan for California is to create a policy platform that is grounded on and informed by the best science, the smartest scientists, the most effective legislators and regulators, and the most strategic advocates. And importantly, the voices of the communities most impacted by this disease. We envision this action plan providing a menu of policy options and interventions for municipal, state, and federal regulators, hospitals and schools and other institutions, businesses, healthcare associations, decision makers who are committed to doing their part to prevent this disease. One of our advisory committee members said it best. You need a multifactorial solution to prevent a multifactorial disease. We interchangeably refer to this policy platform as an action plan because we want the recommendations to be as deep as they are broad. And we want the initiatives to be truly insightful implementable, and actionable. We envision the project's action plan to not only drive breast cancer prevention policies here in California, but to also serve as a model for other states and municipalities. The timing of this project could not be better. Given the current political climate, more and more decision makers are looking to the states and to the municipalities and the private sector to move progressive policy agendas. Next slide, please. This project is guided by an extraordinary advisory committee made up of some of the best and brightest scientists, epidemiologists, environmental justice, social justice, occupational health and environmental health advocates, and representatives of state and federal public health agencies. The advisory committee had their first in-person meeting last month. They will serve as overseers and advisors to all facets of this project. In the first phase of this project, our in-house scientists will scope the scientific literature of modifiable factors linked to breast cancer. The next speaker, Connie Engel, will talk more about how the scoping will take place and how we chose the areas of breast cancer risk that we are focusing on. Next, we will call on experts from around the country and the world to present their best thinking on the science and potential interventions to interrupt, reduce, or eliminate modifiable risk factors for breast cancer, using these study groups as the forum to have these important discussions. Throughout this project, we will engage with community groups throughout the state to better understand the relationships between social dimensions and the built environment, among other things, and increased risk of breast cancer, and to ground this work and the recommendations generated in the real lives of real people. Clearly, this is a massive undertaking with sprawling subject matter, which would be impossible to fully translate into policy recommendations and interventions without the help of our advisory committee and the participants of these study groups. So thank you in advance for your participation. These are the project's principal investigators. Nancy Biermeyer, BCPP Senior Policy Strategist, who is sad she had to miss this study group, but is happy she is playing with polar bears and sliding down glaciers in Alaska. Connie Engel, BCPP Senior Manager of Science Translation, who you will be hearing from soon, and me. Next slide, please. We are so fortunate to have Mary White with the Centers for Disease Control and Prevention serve as a member of our advisory committee. Mary could not join today's study group, but she sent some words of advice and support for the project, which we'd like to share with you. The Division of Cancer Prevention and Control at CDC supports the development and implementation of a comprehensive approach to cancer control, from primary prevention to end-of-life palliative care. CDC looks forward to learning from this effort to develop a comprehensive breast cancer prevention plan for California. Given the complexity of the issues involved in reducing breast cancer risk at a population level, we encourage the development of a comprehensive approach by breast cancer prevention partners to identify science-based policies and interventions. The breast cancer risk for women in California could inform prevention efforts in other states and nationally. And I'm going to ask Connie to just return to the slide right before this. Please take a look at the very impressive members of our advisory committee from throughout California. They're really extraordinary people that are guiding and informing this work, and we look forward to you hearing from many of them on the upcoming study group calls. Next slide, please. This project could not have been possible without the vision and support of the California Breast Cancer Research Project. It is now my pleasure to introduce our program officer, Carmela Lomanaco, who will discuss CBCRP's role in this project.
Great. Hopefully everyone can hear me. Oh, perfect. Thank you. I was just trying to make sure I unmuted myself. First of all, I'm very pleased to be on the call with everyone that has joined us. It's amazing to know that over 60 people had interest in this topic and chose to attend this first meeting. Mel Cavanaugh Lynch, the director of our program, does regret that she is not here to welcome and introduce you to an effort that's 5 years in the making, but she is actually in another country, hopefully enjoying, maybe not playing with polar bears or sliding down glaciers, but having a good time in Ireland. As I mentioned, this is actually the result of a 5-year, pretty extensive strategic planning process that the program has gone through to really identify ways that we can push the field of breast cancer research and even advocacy to think more broadly about prevention and to be inclusive of primary prevention and the downstream causes of breast cancer risk. So on behalf of the program and our council in particular, we are excited to see the breast cancer prevention partners really take on this task. They have all of the skills to get this done. And so really I see that the thanks are to us, but really the thanks are really to you and all of those on the call. And we are very excited to see what happens over the course of this project.
Thanks, Carmela. We're going to switch over to Connie Engel to give us a walkthrough of the complexity of breast cancer risk.
Hi, everyone. I am occupying a couple of roles right now as I advance slides, mute people, and try to find the notes for my call. So I'm going to talk very briefly about the complexity of breast cancer risk, and then we're going to hear from one more speaker. So first thing I'm going to show you is a visual from a paper that is currently under review for publication. And this is BCPP's Web of Causation. Janet Gray, who is a professor at Vassar and has worked with us for quite some time, developed this in about 2008, actually, when, for those of you who have known us for a long time, we published the first version of State of the Evidence that she wrote. That was actually the, I believe, 5th edition of that white paper. And now we have under review the second peer-reviewed paper covering a wide array of risk factors for breast cancer. Those of you who know us well know that our key focus is on chemicals and radiation linked to the disease, but all of those factors, and you see them around the edges of this particular visual, interact with and relate to a number of other risk factors for the disease, including number of reproductive factors, individual genetic polymorphisms, race and ethnic heritage, and the timing of all of those various things. So that is one approach to visualize the complexity and depth of this issue. Another one, and the advisory committee got to hear from Bob Hyatt, the lead author on this particular paradigm, is visualized in this image. And this one's quite amazing. You see the same kinds of lines interconnecting ideas, but they're inside the circle here. And again, a wide array of different factors, environmental and physiological and social, in all of these different layered dimensions. The really intriguing thing about this model, and we will be drawing from this in our work, is that you can insert numbers to talk about the level of predictability and impact on breast cancer incidence from these various factors. So we'll be considering that as we review the literature and look at this. So those are two complexities of breast cancer risk. And then also drawing from a model that one of our advisory committee members shared with us from the National Institute of Minority Health and Disparities. And this really captured a key feature of what we tried to articulate and keep coming back to as we work through this project. And that is that there are multiple domains and levels of influence. It's not just biological or behavioral, because all of that is contextualized within physical and built environments, the communities we live in, our social interactions, cultural aspects in our healthcare system. So this model is more broad than simply breast cancer, but you can see some of these factors that capture structural discrimination and ways that the physical environments around us, our neighborhoods, are shaped by a lot of these factors. And we'll talk a little bit about how all of those factors can influence breast cancer risk. And that will, in fact, be the focus of our first study group. So then we had developed it, as we put together our thinking for this project, a prevention framework really to guide our thinking and, more importantly, the kinds of questions we want to be asking through this process, because we're coming at it with a lot of curiosity and openness. And so we have modified that framework after lots of rich discussion with our advisory committee. And right now it looks like this, and this is iteration 2, and it may be iteration 2 of 10, depending on how things flow. But you can see across the top of this a number of different factors that, you know, research has explored being linked to breast cancer incidence. And then below those, the ones in the dark purple boxes, you see cross-cutting themes like the life course and the dose, which applies as equally to chemical exposures as to the dose of physical activity. You can think of all of these factors in amounts and how much. Social dimensions and considerations, and then interactions across all of those. And below that, you see sociocultural and systemic issues, physical and built environment, and behavior, all of this leading to prevention. And the major goal of this project is to fill in those big gray boxes under the sociocultural and physical, built environment, and behavior with the kinds of interventions and preventive activities that are part of our action plan. And that is the work we'll be doing over the course of the next almost 2 years. And so with that, I'm going to hand this over to Jan Robinson-Flint, who's going to talk a little bit about the community engagement aspects of this work. So Jan, I'm unmuting you right now. Oh, you may have just unmuted yourself. I'm having a really... Yes, okay, so Jan, you can take it away.
Thank you. We were talking about community at our very first advisory meeting, and really looking at how do we define community and how do we define a lot of other words that sometimes pop up in our common usage, but we don't necessarily know if we mean the same things when we say it. So are we talking about allies, and who are allies? Are we talking about partners? And what's the difference between a partner and an ally? And then to start talking about who community is and defining what we mean when we say community. Do we mean there are various communities that we are all interacting with. There are the community of breast cancer survivors. There are the communities that are different generations in their experience and what energy and they bring to the table based on their age and maturity. or lack thereof. Sorry, that's my millennial of the day. But at any rate, those are the things that we'll be looking at in terms of engaging community in a meaningful way, engaging community where our voices have influence and power, that they are respected and treated with dignity, and that we are really defined in a way that makes it easy for us to know our expectations and to know why we're at the table and what expertise that is coming from our voice. So I think that's a little bit about what we were talking about around community, because we did think about the vast geography that is in California. There's really far Southern California, there's urban California, there's rural California, but you all know that. And we all know that we have different experiences in terms of access and different experiences in terms of the influence of all of those sociocultural, economic, and environmental factors when it comes to our health and well-being. Yeah. Thank you.
Thank you so much, Jan. And that aspect of the project will be, kind of solidifying and evolving and deepening as we go, and we'll be reporting back on different things through the course of the various study groups that come through this project. So
I will say that I am absolutely thrilled to be part of the project and absolutely delighted to be charged with the task of including communities as we move forward, and working to hear our voice, and that this is happening, because I think prevention is so key.
thank you so much. We're so thrilled that you are part of this. So I'm going to now talk a little bit about our methods for digging into all of these issues and topics. And those first start actually with community engagement. So these are the various inputs that will help frame the ongoing discussions of different factors related to breast cancer and how we eliminate those factors or reduce them. So community engagement will be one key aspect of that. Another will be some foundational documents, and I'll talk about those in a moment. Further work to systematically scope the peer-reviewed literature, as well as expanded conceptual reviews to make sure that we're covering the cross-cutting themes, those things like interactions and life course and low-dose exposures. These study groups, which allow us to really cover the whole gamut of these other inputs, as well as hear from folks, as Janet said, from across California, the US, and internationally. Really, anyone who has brought expertise at looking at some of the complexities of these factors affecting breast cancer risk and how to ameliorate those will be of great interest for the study groups. And then, of course, the advisory committee, as well as potentially specific issue experts that we may pull in as we go and begin to develop the different aspects of this action plan. So this is a list of the foundational documents we've identified, and collectively these papers really that span from about 2010 to the present have done really broad reviews with expert committees or different academics or organizations with deep expertise to look at different elements linked to causes of breast cancer, especially those beyond direct genetics. So gene-environment interactions are covered in here, endocrine disruptors, quite a lot about food and nutrition and physical activity, and a host of chemical exposures as well. And then quite importantly, one of these papers captures sort of the mechanism by which mixtures might enact upon breast cancer risk. So these foundational documents will help guide the reviews that we do of the more recent literature, as well as serve as providing some of the important data and background for what we're doing. And if you haven't read these, you know, you could put a whole semester's worth of study into something like this, but they are all exceptional pieces in their own rights. In addition, we'll be doing scoping reviews of the literature, and the foundational documents will help us determine sort of where those scoping reviews begin historically. So if, you know, one of the pieces that is our foundational document covers really good peer-reviewed literature up till 2010, we'll start scoping from 2010 onward. If for another topic it didn't look at literature past 2006, we'll be starting for that topic in 2006. So it sort of sets a time frame because these literatures are vast, and we really could do endless amounts of research. And we'll be using a process called scoping reviews, which are a systematic way to scope literature that's more in development and emerging, or that is complex and draws on different types of research methods. Some of you will have heard of systematic reviews, and those are often used in medicine and some public health issues where a question is really well defined, and there are a number of studies that, you know, have some consistency in how they were designed so that you can look at their quality and assess them on a very specific set of criteria. Scoping review goes a little bit broader than that, kind of pans back and tries to get, as the name would portend, a sense of the scope of the literature. So it's a little bit less restrictive in terms of method, but it's still very rigorous and transparent and comprehensive, which helps us. And we will mostly, where it's possible, be looking at scoping the literature of meta-analytic studies and also actually systematic reviews that have been done on an issue. And that won't be possible for everything, but just to make sure we're all on the same page, a meta-analysis is a method that lets researchers statistically combine data from different research projects. And that way you can estimate something a little bit more robustly and accurately, at least within the constraints of how it was studied. This will be particularly useful, I think, in making the case that issues are important and on a very fundamental level that they impact breast cancer risk. And once we know that, we can then make the case that changing them has the potential to impact risk at the population level. Those are not necessarily complete, and we spent a lot of time in the first advisory committee meeting talking about the limits of meta-analytic studies, which often don't capture some of the most important nuances in a given study, interactions that perhaps one study looked at, but none of the others did. So we won't end there, but it's a really good starting point for making the case that a factor is important for breast cancer risk. And I think that'll carry a lot of weight with regulators and policymakers because it sets that foundation. And so this is an example of how we conduct the case study scoping reviews. And it's basically just inputting a whole bunch of search terms into the databases for peer-reviewed literature. And we mix all of these different terms together and repeat and repeat and repeat the searches. And then we have to screen all of that literature. And so we go from about 1399 studies that we found when we did the scoping review on alcohol to actually about 10 meta-analytic studies and 7 critical reviews. So it was, again, all of these search terms that led to those 1,400 studies. But once we started reading through those, only about 17 of them really met the criteria for what we were going to look at for the focus on meta-analytic studies and pooled analyses. Now, because the meta-analytic studies have limitations, we will also do these expanded conceptual reviews. And that will let us make sure we are capturing those cross-cutting themes of interactions, life course exposures, dose, and also the facets of the social and built environment that will come up again and again in these study groups and across all of these factors, as well as situations in different communities for whom the evidence in the meta-analyses may not be relevant. If no studies look at risks for a particular group, if no studies are reporting on the interaction of alcohol and race and ethnicity or poverty and breast cancer risk, then we want to capture that and be able to talk about the limitation that we don't have good knowledge for a particular group. So that will be a key thing that we look at as well. And then, of course, another input is the study group sessions, and we're going to come back to this, but these are our current proposed topics. And very importantly here, these are attempting to capture a lot of the most complicated questions and issues and topics. So we want to make sure that we have areas that we're discussing those that are the richest and most complicated. Now you can imagine like each one of these topics could actually cover days worth of content and have about 50 subtopics. So we'll want to focus particularly on complicated areas, and these will each be shaped by the speakers that we bring in and their specific focus. So they should ask captivating questions, but they may or may not ask and answer every possible question, because we could do this for about 20 years if we wanted to. And then, of course, as we mentioned and have talked about, our incredible advisory committee, as well as input from other key stakeholders. All of this is sort of circular, so that what comes out of scoping reviews will be presented to the advisory committee and at study groups and in community meetings. And then it'll keep informing in kind of a circular yet moving way what happens in each of the next meetings. So we hope that it maintains a really high level of vibrant conversation throughout. And then, of course, we're going to develop recommendations for the action plan. And I'm giving you a very top level view of that. But we will review where it exists, evidence on interventions at the systemic, policy, and individual levels that reduce factors of concern for breast cancer or increase those factors that may look protective, as well as soliciting input from community members on things that they think would work or could work or have worked, and reviews and recommendations from respected sources. And so there is a pretty deep literature in intervention science, and these are just some of the sources internationally that do research on interventions and test them. Most of them, but not all, are focused on quite often individual behaviors or individual behaviors within one or two minor contextual factors. And so, we'll draw from that literature, but then we want to modify those to consider the very different social environments, built environments, disparities in cultures that may or may not have been included in the research. And also think about ways we can scale an intervention so it becomes a policy that makes the healthy choice the easy choice. And that I'm drawing from actually Jan's language, which just really resonated for all of us at the first AAC meeting, that what we want to do here is make it easy to choose the healthier, better way of being. And a lot of social factors don't make it easy to pick that healthy choice. They don't put that right in front of us. And we want to draw on interventions and develop interventions that meet community needs. So with that, I am handing it back over to Heather, who will talk about how you can be involved and involve your communities and networks.
Great. Next slide. So, well, that was a whirlwind tour through a lot of thinking that has gone on over many months in developing an approach to how we can develop this action plan for the state of California, which, as we mentioned, we hope will be used into the future for other states and possibly building towards a national model for breast cancer prevention. And because that is no small task, we need you. So I wanted to talk a little bit of ways for you to engage in this project over the course of the next year and a half or so as we build it out. So the obvious first thing is to keep coming back to the study groups. You're all invited. I'll be staying in touch as we announce the details for future study groups. And these study groups are open to anyone who is interested in this project. So we highly encourage you to invite your colleagues, people who might be interested in participating as well. If there are people you think we should be reaching out to for the study groups or consultation on this project, even if you think it's such an obvious person we should be in touch with, we couldn't possibly not know about them, sometimes that's not true. So I welcome your comments on organizations, studies, people that we should be paying attention to. You can email me at the contact information below. We really believe that wisdom lies in all sorts of people in all sorts of places, so we invite you to contribute to our project in that regard. Another thing that we're very interested in is the intervention. So Connie mentioned a number of databases that study interventions, and we're certainly going to be looking at the published literature, but there is so much that has not been studied and put through the peer review process that might be going on at people's cities or counties or school districts or PTAs or states or workplaces or you know, all these different places where our lives actually happen. So if you know of interventions that are creative, that maybe are breast cancer specific or maybe indirectly address breast cancer, but address things like access to healthy food or safe neighborhoods for walking and physical activity and some of the different systemic approaches that people have taken, please go ahead and be in touch with us about that. We really do want to start culling all the best examples out there, and we want to be able to innovate with our interventions as well. So we're not looking to just do and propose what's already been done. We're looking to be creative and take some of the best of the existing knowledge that's out there and even evolve it a little further if we can do that. And then ultimately, we will have this action plan somewhere in about a year and a half or so that we will be pushing out into the world of action. So we really are looking for allies to help us with distributing the final product and looking for ways that their group of people, their community, their organization might be able to help us get the wheels turning on the recommendations that come out of this process. So put that you know, in the back of your mind for now, but we would love to engage you in that process when we come to the end of that. So with that, I think we are on to the discussion portion of our presentation. Oh, sorry, we're going to post those study groups one more time as we deal with the technology of getting ready to go into our discussion. So take note on these dates here. I will go ahead and email those out to everyone after this call when we email the link to the recording of this call as well. So you'll be able to see that. But you might notice things that are especially of interest to you. So just take a look there. And then, so now we're going to go into the discussion piece of this. A couple of administrative details before we open it up. So one thing is, if you leave the call, please make sure you have hung up your phone so we don't have to listen to the hold music that you might introduce into our conversation. So if you're leaving, go ahead and hang up. You can call back in if you need to. That way we don't compete with the instrumentals. When you are interested in speaking up, please introduce yourself, your organization, and go ahead and let us know your comments or questions. We also have a chat forum that I see some of you are using or have used mostly to check on sound at the beginning of the call, but you can go ahead and put some questions in there as well if you don't want to hop into the conversation piece. We're happy to field those that way. What we're going to do is we have all of you on mute. We should each be able to see a little icon that looks like a microphone somewhere on your screen. I think it will be at the top or the bottom that says mute. So you can unmute yourself if you want to jump into the conversation. If you're not, if you're just listening, please go ahead and keep yourself on mute so we can keep the noise to a minimum in the background. So with that, we'd like to open the floor to conversation. We have plenty of time, so we welcome your feedback, your thoughts, and your questions.
This is Margaret Kripke. Could you say a little bit more about the study group sessions and will they be in person or they will be telephone, webinars? How are those going to be done?
They will be done. Hi, Margaret. It's really good to hear your voice. They will be much like this session on this platform, actually, with visual slides and the webinar forum. And much like this one, we hope to leave about 35 to 45 minutes for discussion on each of them so that a lot of ideas can be shared. So that is the intent with the study groups. Yes, and right, I am reminded that we will be, we'll have a Dropbox folder that will have reading materials that we gather from speakers, or if we find particularly exceptional articles in our scoping reviews, we'll share those, as well as afterward, we'll post the recording of the sessions and notes. And that should be a folder that anyone could also, you know, if they have an action plan or an intervention or a peer-reviewed paper that they think we should see, they'll be able to add to that. So we hope it'll be a pretty dynamic way to share maybe an overwhelming amount of information, but we'll do our best to keep on top of it.
Hi, Heather. This is Natasha Riley of Vista Community Clinic.
Hi, Natasha.
So I just want to get clarification on the expectations of the study group. So we're going to be reviewing articles, we're going to be reviewing research and making comments on it, or?
You can engage at a lot of different levels. So we would love for people to read all the materials ahead of time. And we also live in the real world, so we know that that may or may not happen. But we think that the people who are especially interested in articles might read articles ahead of time. People who are especially interested in communities and interventions might read those, anything that we have in that area. But also, if you don't have time to read ahead of the call, you are still certainly welcome to engage. Not everything that's of value has been written down and posted in our Dropbox. So it's a little bit come as you are, and if we notice that there are really good points of connection with someone on a call and we want to dig in a little deeper after the call, we might set up a one-on-one conversation. But we think that there's value in people just listening in to find out what's going on and where the good thinking is, but then we'll, you know, anything that people want to engage with and share with us in these calls is certainly welcome. Does that cover it for you, Natasha?
Yeah, I think so. So also, if there are activities or prevention strategies or things we think or interesting or important, we can upload or give you information about those for
Yes.
to be a part of the discussion?
Yes,
Okay.
exactly. So at any point along the way, feel free to email me with any recommendations, and I will start building out folders for all of these future study groups, and we can start posting those into Dropbox as we build that out. But I'm going to be the keeper of anything that people send between now and when we do these study groups. And then you can also bring things up on the calls, and after the calls themselves, you can also send things along if something tips off your thinking.
Okay. All right. Thanks.
Great.
This is Jan. Can I weigh in on that also?
Yeah, please. Yep.
So a lot of times when we talk about study groups, we really want a dynamic mix of people in the group. So it's not just scientists or not just academics or not just community, but people who are having a lived experience with the topics that we're talking about. And that means that, we want lots of perspectives and lots of input to make this a really round and a very rich discussion. We don't want just researchers talking about research or academics talking about, the latest study report or something like that. We want people who really bring different perspectives to the study group so we can see what synergy is created or how to look at something with a different lens than we might be looking at it. So I just wanted to add that part because when I think of study groups, for instance, in my office, we're reading a particular book right now, and that's what our study group is. We read the book, then we have discussion about particular aspects of the book and that type of thing. And I think it is important for us to have many different voices and perspectives in the dialogue or in the discussion, because I think that inspires us to think differently or to think more or to remember also.
Yeah, and I'll just second that and say those are values core to the project with all of the staff here as well. So thank you for saying that so clearly, Jan. We definitely agree. And just to build on that a little bit, we are in the process of building out our plan for what community engagement looks like in this. So there may be a number of things that happen that are specifically about talking directly with people who are on the front lines of these issues. And like I said, we're not sure what form that's going to take. That's in the process of being developed right now, but the study groups are one forum where we would like to welcome everybody, and there will be other forums as well. So I see a question that came in through the chat that I'll just address for a second. It says, are you planning to collaborate with SF CAN? Breast cancer is one of the cancers that they are focusing on with the San Francisco Cancer Initiative. Oh yes, somebody else would like to answer that.
Hi, this is Sharima Rasanai. I'm the Director of Science at Breast Cancer Prevention Partners. Yes, Diane, great question. And yes, we are working, as you know, Bob Hyatt is sort of heading that up. He's head of the network for that. And we're working with Bob, and we're going to be interfacing with SFCAN. As you know, it's more than just breast cancer, but yeah, definitely.
Okay, other questions or comments? So I'm curious, for those of you out there, maybe outside of California, if in hearing about this project, do you see something, a nugget in this that might be of interest in, as you think about what is possible in your state or region. Dots you'd like to connect with us with the work that we're doing here. And if you'd like to comment, you have to unmute yourself. Oh, yes, and I see someone just asked, are folks outside of California welcome to comment? Yes, please. And if you'd like to unmute yourself, just press the icon that looks like a microphone. Oh, we see New York is saying, watching from New York to see how we can implement something like this. Does anyone else have questions or comments? Okay, with that, I think we might go ahead and wrap up the call. I want to thank everybody for participating today. We had a great crowd of people from a number of parts of the country. We are really looking forward to connecting with everyone into the future. Please know that you'll hear from me on future study groups and be invited to that. My communication is always open, heather@commonweal.org. If you have questions or comments along the way, and we're really looking forward to building this out and seeing what we can do here in California and then other places into the future. So thanks so much, everyone, and have a great day.
Thank you.
Thank you so much.